Well, the reality is, although the NHS can be very good at looking after people in a hospital or if you go to your GP, where it's less good is joining up data or making data accessible in a very timely manner. What we need to do is, in the most effective and efficient way, is to try to use the large amount of data that's collected routinely, both through trials, but also through all the data that's collected day in, day out about individuals for their benefit. And so much of the work that we're doing is both trying to shine a light on how we can improve earlier diagnosis, but also using that data as a surrogate marker when we introduce interventions, which could be drugs or digital innovations. Because many of the patients that we're seeing with cancer, even a delay of a couple of weeks for a diagnosis can have a catastrophic negative impact on their health and their outcome. And so we work with researchers and scientists, life sciences companies, with the NHS and charities that are cancer specific, really to create a coalition who have the values that are looking at about how we can use data appropriately.
There are a lot of people who are really, really passionate about the use of data, but not everyone necessarily shares that passion, and we need to start to understand why. The DataCan patient and public involvement and engagement group is really there to ensure that we act fairly, transparently, and that the needs and desires of patients are at the forefront of what we do.
We're very fortunate to be amongst a group of health data research hubs working with HDR UK, and they've created a portal, and so researchers can use keywords to identify what research is being done in a particular area, what data sets are available. And we can provide them with some of the tools and resources around data analytics or how they might want to improve the quality of that data. But equally, we can link them up with researchers and collaborators across other partners across the UK because of the networks that we've managed to build.
IQVIA are a founding partner of DataCan. Our main contribution to the hub is really the build-out of the Cancer Data Network. The benefit that can be had from an individual's patient record goes far beyond those hospital walls if treated with respect and privacy. And what the CDN enables is the safe flow of that data for researchers to understand more innovative therapies, for clinicians to really understand what could the best treatment option be, and also to potentially offer innovative treatment through clinical trials.
The triple negative breast cancer project, it was kind of a proof of concept project. There were 4 partners in the collaboration, which were the 2 cancer centres in Edinburgh and Leeds, DataCan, and also the company, Roche. And I think all 4 partners were necessary to make it a success. I think we've not served our patients well by not using data in an agile way. We need to do better, and I think DataCan's got the skill sets, infrastructure and capability to make that happen.
Flatiron Health is a health technology company that is fully focused on cancer. And what that kind of means in practice is really thinking about how we can use the data that's generated from patients' real-world experiences. We connected with the patient and public involvement group at DataCan, shared what Flatiron did, what we were hoping to do, and we had a very open dialogue with patients to understand what resonated, what questions they had, what concerns they had. I think it's really pushed us to think differently about the role that patients can play in our organisation, and really challenged us to think more broadly about the types of decisions that we can take with patients.
Back in March 2020, COVID-19 began to have an impact on the NHS. And when clinicians tried to find out, for example, what was the impact on patients receiving chemotherapy, or what was happening to the number of people going to their GP with a new cancer diagnosis, when they tried to access the traditional data sets, there was a time lag. That wasn't helpful during a pandemic. Using the network of DataCan, we demonstrated very quickly that there was a very significant impact both on patients and on services.
DataCan's real-time data network has already received data from 5 of the Northern Ireland Health and Social Care Trusts and was part of the work which contributed to the published work. And we will work with DataCan and help provide opportunities to mitigate the effects of the pandemic and build back better and smarter.
During the pandemic, the work that DataCan did gave us the ability to then, hold government and NHS to account and say, look, this is a huge issue, you need to be addressing this. Everything that we have in place today for bowel cancer patients has only come about through research and through responsible use of data. All the treatments that we have are all from clinical trials, all of the diagnostics that we have in place for bowel cancer patients, that's been refined and improved over generations by using data.
Through the work of DataCan, making data more readily available to the people who need it, such as cancer researchers, we are able to get better diagnostics. And the sooner cancers are diagnosed, the better outcomes that patients tend to have. There can be better treatments, more personalised medicine. It can really help to turn the tide of this really horrific disease.